Can urethra problems cause urinary retention? Have you ever wondered if issues with the urethra could lead to urinary retention? The answer is yes. Problems affecting the urethra can indeed cause urinary retention. This condition happens when the bladder cannot empty completely or at all. It often results from an obstruction or impaired bladder muscle function. Let's break this down a bit more. The urethra is the tube that carries urine from the bladder to the outside of the body. For normal urination to occur, the bladder muscles need to contract while the urethral sphincter relaxes. If there are any structural or functional problems in the urethra, this process can be disrupted. One common issue is urethral stricture, which is the narrowing of the urethra due to scar tissue or injury. This narrowing can partially or completely block urine flow, leading to retention. Another cause could be a urethral blockage, which might happen due to trauma, infection, or even tumors that physically obstruct the passage of urine. Inflammation and infection are also significant factors. Conditions like urethritis, which is the inflammation of the urethra, can occur due to urinary tract infections or sexually transmitted infections. This inflammation can cause swelling that narrows the urethral lumen, making it difficult for urine to flow. Trauma to the urethra or surrounding pelvic structures can lead to swelling, scarring, or disruption, which can also result in urinary retention. Additionally, other structural abnormalities, such as congenital defects or changes after surgery, can affect how well the urethra allows urine to pass. There are other factors related to urethral problems that can contribute to urinary retention. For instance, bladder neck obstruction or scar tissue near the urethra can play a role. Pelvic masses or tumors near the urethra may compress it externally, leading to further complications. Even tight pelvic floor muscles or pelvic organ prolapse can indirectly affect urethral function. It is essential to understand the clinical importance of urinary retention caused by urethral problems. This condition can be acute, meaning it occurs suddenly and severely, or chronic, developing gradually over time. Acute urinary retention is a medical emergency that requires prompt treatment to relieving the obstruction and prevent damage to the bladder and kidneys. Chronic retention can lead to bladder infections, incontinence, and long-term urinary tract damage. Interestingly, some urethral problems causing retention may be related to bladder cancer or its treatments. Tumors located near the bladder outlet or urethra can obstruct urine flow. Additionally, radiation or surgery for bladder cancer can cause scarring or strictures in the urethra, leading to urinary retention. In summary, urethral problems such as strictures, blockages, inflammation, trauma, or tumors can indeed cause urinary retention by obstructing urine flow from the bladder. Addressing these issues is crucial for maintaining bladder health and preventing complications. If you experience symptoms of urinary retention, it is vital to seek medical evaluation and treatment from healthcare professionals.